Hello and welcome to Maternal Mental Health Awareness Week, where we are marking 10 years of the week with our theme, A Decade of Voices. My name's Eve Canavan, I'm one of the co-founders of the week, and today I'm so happy to be joined by my friend Sally from Pandas, who I've been promising to have in the Awareness Week for ages, and I said to Sally, I've come through because I wanted to highlight the work that you're doing, and what a nicer time to do it on year 10. So welcome, Sally.
Oh, thank you so much for having us. We love Maternal Mental Health Awareness Week. It always goes so busy, so I know how you feel. But yeah, it's so cool to be here. Thank you for inviting me.
No, it's a pleasure. It's my pleasure. And I think we'll go and have a little chat about Pandas, Sally, and the work that the organisation does in just a minute. But just a little line before we start into that. This conversation between Sally and I today is for information purposes only. Anything that we say to do with perinatal mental illness or mental health should not replace any individual information you receive yourself from your own healthcare professional. And with that, Sally, let's start off. To start from the very beginning, what is Pandas? Who are you? What do you do? What's your mission?
Thank you, Eve. So, we are a perinatal mental health charity and we support all parents and carers in their mental health, in their perinatal mental health, although lots of people understandably often don't know what that means, when they're first starting their journey. It just means, as I know I'm preaching to the converted here, Eve, but the time around having a baby. And the thing about pandas is that we have no cut-offs. So in the NHS world, you'll often hear things like, oh, you can get support up until your baby turns 1, which we understand, but Pandas absolutely has no cut-offs there. So we can support you if you're pregnant, we can support you if you're trying for a baby, we can support you if you have a 5-year-old and a 3-year-old, we can support you if you're a grandparent. It really doesn't matter. And if you are the friend of somebody who might be struggling, or you just want some information, that's also fine. So we're also for kind of networks of parents and carers as well. And we began many years ago. I wasn't around when the charity began, but the charity was started primarily to support mothers with postnatal depression, but we've massively evolved and changed since those days, and we now support all parents and carers, and we support them with a whole range of different issues. So absolutely not just about postnatal depression. We one of the number one reasons we speak to parents and carers and their networks is that they might just be really lonely and isolated,
Mm.
or they might have prenatal anxiety, they might have intrusive thoughts, they might just be having a really bad week or a really bad day, and that's fine. And we really do encourage people to get in touch with us as soon as possible. That's one of the key things. I think we're used to hearing in this NHS world, you kind of don't go to A&E until you're really bad. You've got to be rock bottom. But we are the absolute opposite. We say the sooner the better, because we know that if people can get support as soon as possible, we're much more likely together to nip it and to help them and to stop it going into anything more sinister. So that's the message we're always trying to get out there. But yeah, I guess our mission really is to ensure that no parent or carer feels alone in their mental health. That's always been our mission, and that's what we are continuing to try and do. But yeah, it's been a great journey up until this point. Loving the journey of the charity.
Yeah, I know you love it. And I think how it's evolved over the years, I see now on your social media and obviously being friends with you, all the different groups that you run. And I know you've got like an antenatal course starting, and you do so much stuff at the moment. You've been doing with like the parent gap in work, looking at all the different things that contribute to, I guess, wellness in the perinatal journey. So exactly like you're saying, we're so used to saying perinatal is up to a year after having a baby, but we so realise people before they're even pregnant, struggling with conception, and preconception support, people are finally getting that in places now. Being pregnant and getting antenatal depression, prenatal depression, having a baby, not feeling how they thought they were going to feel. There might not be a label attached to it yet. People say, I'm not severe, I'm mild, I think I'm moderate. Doesn't matter, you still deserve help. And I think that thing that you say of having somewhere to go that captures people to say, we know you're lonely, let's see what we can do to help you with that, can stop people getting to the severe ends. And I think we're so grateful that there's so much support with people who are severely unwell with perinatal mental illness, which is fantastic. And that's evolved over the last 10 years. But we definitely know that there are people still falling through the gaps. People who feel like they don't fit into certain things that they're reading, so they either don't warrant help or don't need it. And people
Yeah.
sometimes look back and go, actually, I think I must have had postnatal depression, didn't realise it. And they say my kid's 5 and I still don't feel right. Can I still get support?
Mm.
And I think that was so lovely that you talk about the work of the organisation being so welcoming to all families, whatever they look like, however they're formed and however they're together, and actually whatever age their children are. And I think
Yeah.
one of the really good things about Pandas, which is that it is very much like a volunteer-led model. And so both you and I have experienced perinatal mental illness and we're doing the work that we do. And so it is that thing of being an expert by experience, if you're going to use fancy words. But in short,
Yeah.
it's knowing that someone who's been through it is there to say to you, I got better, you can too, and I want to help you get better. So talk to me a little bit about the support Pandas offers, and how it focuses an awful lot on volunteers who've
Yes.
experienced it or indeed supported somebody through it.
Yeah, totally. So our volunteers really are like the absolute heartbeat of the charity. They're amazing people, and we are very much a peer-to-peer model for a charity. So we are all about peer-to-peer support. So what that means is we're not medical experts, we're not clinicians. We don't give medical advice, but all of our volunteers are trained, and we're so one of the most important things for us is training, because we know that the when we give our volunteers the best training possible, they will then be the most confident they can be to be able to deal with a whole host of different issues, because we really do recognize that it's not just oh, I've got this perinatal mental issue. There's a lot of intersections. So there'll be people that might be experiencing, for example, domestic abuse or really bad financial worries. They might be neurodivergent. They might be, suffering all sorts of, they might be minoritized for whatever reason. So we do have really good training for our volunteers, and we also use other people like Women's Aid, for example. We use Neurodivergent Birth, who's an amazing organisation that works with neurodivergent parents. We work with the Self Harm Network for Scotland. We work with lots of different organisations around things like cultural sensitivity, for example, to really get that whole full length of breadth, so our amazing volunteers are in the best position they can be. In terms of the support services, we do recognise that people like to communicate and get support in many different ways. So we've got a few different ways that you can get that support. So we've got a WhatsApp support service that's open every day, Monday to Friday, and that's where you can literally just send a message on the WhatsApp Messenger. People like that because you can kind of do that while you're feeding a baby, for example, or while you're in the park, or even when you're in a busy house, because people often, they might have loads of family around but still feel lonely and want that
Mm.
support. So I think that's really good for that sort of situation. You've also got that slight level of anonymity. You don't have to give your name, you don't have to give your gender, for example. So people like the WhatsApp for that reason. We also, though, do have a bookable call service. So you can go onto our website and you can book a time that's convenient for you and actually have someone call you, which people still love, which is great. We have 2 online Zoom sessions a week where you can actually come in, a bit like our room here, Eve, and get that support with our trained Pandas facilitators. We've got one on a Monday morning and one on a Wednesday evening. That was kind of born out of the pandemic, and it's one of those things where we're like, why didn't we do this before? Of course, it's an absolute nightmare to get out of the house, especially if you've got young kids. Like, let's keep this. So we've got another
Yeah.
one. So we've got 2 of those. And we've also got in-person groups, and they're sort of dotted around the country. So we've got, I think, over 30 now. They all obviously had to be shut in COVID, and we had to start from scratch after that, and we're doing really well. Yeah, we've got a good number now, and you can go onto our website, pop in your postcode, and find your nearest group. They all run in their own way, as in, like, some run every 2 weeks on the Thursday, some run every Monday, some are in local village halls, some are in children's centres. They all have their own specific venue and frequency. And we've got some new services that we're really proud of that we've just launched, actually. So we do have a new antenatal course, And the whole idea of that is we know that there's lots of antenatal courses, but this one is specifically to try and help people prepare from a mental health point of view of becoming a parent, because we feel that that's sometimes a little bit missed. So this is really focusing on the mental health side of things, how to prepare, how to kind of like prepare yourself and your family for the huge change in life and mental health that you are going to go through as a parent. So we're really proud of that. We've also got a new peer-to-peer support scheme as well, where you can be matched with a Pandas volunteer and they can kind of like be your buddy for 7 weeks. We have that time frame just because we think that's a really good sort of like time frame to aim for. So we're not saying we're going to drop you after those 7 weeks, but we're going to say let's work on this for 7 weeks, and then you can go away and see how you go. If you need to come back, that's fine. You can always come back. But we think it's nice to have a little something to aim for. You'll be matched with someone that we kind of do a good matching system. So you don't have to write tons and tons on the sort of like referral or application to be on this peer-to-peer scheme, but just a little bit so that we can try and match you with somebody that's perhaps gone through something similar or just understands it or will be a good match for you. So that's the peer-to-peer support scheme. So yeah, I think they're the main Pandas services we've got at the moment that we're really proud of, but most of all, we're proud of our volunteers, and so many of them are people, like you say, Eve, who have gone through something like you and I have, probably thought they would never ever get better, possibly use the Panda services themselves, have recovered, because we know that with perinatal mental health, most people will recover, although it doesn't feel like it at the time, and then they want to give back. So we always have this constant, amazing stream of people that want to come and help, which is amazing for us. We love it. But yeah, they're just amazing people, these volunteers. We adore them.
That's why I think it's so pertinent when the theme of this year, when Farah came up with it in the partnership, a decade
Yeah,
of voices, because the week was built on lived experience. And I think what
yeah,
we've been seeing over the last like 10 years in particular is organisations really taking on people who've experienced it, who've supported people through it, employers who are supporting, employees through it,
yeah,
to learn and grow and being part of their organisation to help it grow. And lived experience really does, it really is the best kind of indicator of recovery in the future. So when people say, I remember saying to my mum, I'm going to be the only one who never gets better. I remember saying to my nurse in hospital that
oh,
I'm going to be the only one who never gets better. And then when we talk to people, we hear that same thing, don't we, Sally? And
yeah,
you think, to
yeah,
hear someone say, I promise you will, I went through
yeah,
something really similar to you, and I promise you will, gives a hope that you can't find anywhere else. And knowing that someone
it
else has been
does.
through it and to see
Yeah,
them recovered, recovering, getting better is incredibly
mm,
powerful. And
very
I just
powerful.
think it's a real kudos to people as well who've been through it, who then want to give up their time, their
Yeah,
time and their energy to train, to learn, to set up a
yeah,
group. And I think you go into Panda's website, you can put your postcode in, as Sally says, you find the groups. But then also a lot of them have got their own individual Instagram page, so you
yeah,
can kind of see what the location looks like that you'll be going to, and what your group leader looks like. And I think that brings me on to my next question, Sally, which is, if someone's at home, and there'll be so many thinking, right, I really think I really value going to a group, dialing into a
yeah,
group, accessing a service, but it feels a bit daunting. It feels a bit
yeah,
too much, and I'm really frightened.
yeah.
What would you say to that person who's thinking, I think I want to access your services, but I'm feeling a bit nervous?
Yeah, well, there's lots of things we can do. So you could just start off, for example, by using the WhatsApp, because that I think that feels a bit safer because you don't actually have to talk or anything like that. And you could just start off by sending a message on WhatsApp. That's one thing you can do. Also, know that if you did, for example, the Zoom support call, you don't even have to talk. So for the first one or two or three, or you don't even have to talk ever if you don't want to, but just while you're getting your head around how it works, just come along, have your camera off. I think they probably will just check initially, just say, oh, hello, can I just see? Brilliant, thank you, because we just need to for the safety of everybody. But once you've done that and no one has to see you, just the person that's running it, you can turn your camera off and you can just watch. And sometimes that's so powerful because you can just listen to people, what people are saying, the issues people are going through, and you'll probably be like, oh my gosh, me too. And after that you probably will want to talk, but it's totally up to you. If you just want to listen to the first few, that's fine. They have a kind of a format, but that will be explained when you join the call. And for example, there might be some sort of grounding techniques to use or something like that, or a meditation, but you'll always be given warning of that, and you're never under any pressure to speak. So I think that's probably a good route in, because you can just kind of feel like you're just actually watching initially, just to get your head around it and see if it's something that you do want to really dive into. And then you'll probably find, like, honestly, people like that who have done it in no time at all, they're offering support, they're offering advice to people and massively helping them. That's the beauty of the peer-to-peer support model. You'll get people in the absolute depths of struggling, and they're the ones helping others, and that in itself is so powerful, because they're like, oh my god, I really helped that person. Like, it doesn't take away my struggles, but and that's what the power and beauty of peer to peer is. You're just, everyone's helping each other. It's such a beautiful thing.
Absolutely. And I think there is that thing of like, there's a community, even if not everybody has to see each other, and I think it
Yeah,
is that thing of, it was born out of the pandemic. You're creating a Zoom, you might have your own personal boundary where you're feeling like you're not quite ready to put your camera on. Indeed, you don't even always have to, but you're there amongst other people wanting to seek help and getting some. I've got a couple of offshoot questions that I've just thought of.
oh yeah,
Somebody might be thinking, okay, well, I've gone to my doctor and I'm getting a bit
yeah.
of help from them and things. Can I still access your services, Sally?
Yes, totally. There's no like, we won't even ask you that. You don't need to tell us. You can be getting all, you can be in therapy. It's fine. You can still use Pandas. We have no waiting lists and we're free. So like, yeah, we have the capacity and we're absolutely available to anyone. We don't ask you. We don't say, have you got a diagnosis, or do you think you need a diagnosis? It doesn't matter. It's fine. Yeah,
Yeah, you don't need a loan.
absolutely.
And I think we see that so much into our inbox. You probably do. And I think on the survey as well, people say, I don't have a diagnosis yet. I've just started to realise I don't
Yeah.
think I'm very well. And I say, you don't have to wait for help. You don't have to
No.
wait for that to come along. There are people who want to help you. And so I think
Yeah.
that's really important to say. Of course, well, the whole point of the week is that it's about free resources, so that you're a free organisation who'll provide this information and support for free. If
Yeah.
somebody is at home who, like us, has recovered and thinks, I think I'd quite like to maybe see if I can like use my experience for like a bit of good and would like to maybe volunteer or something. What do they do, Sally?
Oh, we'd love to hear from you. So there's a section on the website, if you just hop onto the pandasfoundation.org.uk, there's a whole section for volunteering for us, and it gives you a bit of information about what's involved, the training you'll get, and then you can just fill out a form, and then one of our team will get in touch with you and talk you through it and explain what's involved, what opportunities we've got at the moment. So, it could be that you could be a volunteer on the WhatsApp service, it could be that you want to start your own face-to-face group, it could be that you want to help on these online Zoom calls, or taking actual phone calls on the bookable call service. So there's lots of ways to be involved. Yeah, and we absolutely encourage that. Especially, we're always trying to get groups up and running up and down the country, and that is going really well. But there's still areas that obviously don't have a group, so we're absolutely looking for people to do that, which is great. And another bit of advice as well is, if you're thinking, oh, face to face group, that's a bit scary, which I totally get. You can just message the group leaders and get a bit of information. Just ask them, what's the vibe at the group, and have a chat with them before you go, because that will hopefully make you feel a bit more settled before you join, because we realise it is a bit of a big thing, especially if you don't know anybody. But we have such beautiful friendships that come out of those groups. It's so beautiful to see. So I hope people do take the plunge and go for it, because it's what they're there for.
Oh, thank you. And I think that brings me to my last point I was going to say to you. As someone who went through perinatal mental illness themselves and now works in an organisation that supports people so brilliantly, if someone was watching at home and isn't feeling very well, whether it be that they're pregnant, they've had their baby, they're with their toddler, they've got their child age, child at home, and they're thinking, will this get better? Like, will I? What would you say to them?
Say yes, you will. I promise you will. But don't worry about, oh, should I or shouldn't I? It took me absolutely weeks to go to the doctor. I didn't use Pandas till far too late. And I really wish I had. It took a doctor sitting me down and saying, you have late onset postnatal depression. I don't even know if I did. Like, these labels, I don't know. Like, maybe I did, maybe I didn't. But it took him saying to me, you're ill, before I got any support. And I just wish it was normalised that I could have picked up that phone or gone onto the Pandas website as soon as I started to think, oh, I'm turning into someone I don't recognise anymore. And the more we normalise that, and we know research shows that if you get support earlier, you'll get better quicker. So I wish that was much more widely known, because yeah, you know that, Eve, you've been through stuff too, haven't you? And I just wish everyone knew to get help as soon as possible, but we totally recognise that it's not as easy as that. But with Pandas, we are free, we have no waiting list, and we actively encourage it. So please just get in touch and via whichever means you're most comfortable with.
And you're so right by saying that. I think, what I can say to people at home watching is you're not alone. So
Yeah.
Sally was poorly. I had postpartum psychosis. No, I was an inpatient, like all the things people feel is scary and those kind of things. You do get better. You do emerge from it,
Yeah.
and you can go on and have a beautiful and bright life. Here I am with my 16-year-old advising for his GCSEs, which is a whole other story. But, I never thought I'd get to this point. And also,
No.
when Sally talks about the camaraderie and the friendships and things you get, you learn things through shared experiences. Sally and I are great friends, in this field. And I think I really respect that Japan has evolved over the years and the work that you do. You do great work with organisations who I really respect, like Neurodivergent Birth. I think Victoria's
Yeah.
made the most incredible organisation. And you've done stuff with the
Agree.
motherhood group, you're working with the Paternal Mental Health Alliance. I think you've done the stuff you've done around supporting people in the workplace over the last year has been really good. And
Mm.
so I just think I'm really glad that we've been able to give you the space, where
Oh,
in
thank
a
you.
or just in a
Well,
little short over under an underwhelming. We always say to make little short sessions that people can pick up their phone. We always think so people
yeah.
can go, I watch this,
Yeah, yeah,
and this
yeah,
is what I need,
exactly.
and
It
that's
is
what I think this
hard to
is.
explain. It's hard to explain sometimes what it's all about and what's the vibe. And yeah, I'm really pleased you've allowed us to do that today. I forgot to say as well, also, if you go to the Pandas website and you go to our resources page, there's loads of free downloadable resources that you can use. For example, we've got if you are feeling like, oh, I don't know if I need to go and see a doctor or not, or I'm not feeling right, but I feel so nervous about seeing my GP or my health visitor, there's a form that we've devised with Make Birth Better and Dr. Poonam Krishan where you can print it out or fill it out online, and it will really help you with the kind of vocabulary to explain how you're feeling. So you don't have to sit there and be like, oh, you can just literally hand them this form, and then that will help them be able to support you as well. But there's all sorts of resources on there. We've got like a mood tracker, because we feel the best way. We know that lots of people often get fobbed off with, oh, it's just the baby blues. It's just the baby blues. You'll be fine. It's just the baby blues. We're so sick of that. So we feel the only way really to get a gauge on that is to track your mood in those first few days. And it's a really simple tool. And then that will hopefully give you the kit to know whether you need that support, which, we really encourage you to get. There's lots of other resources on there, but yeah, I just wanted to point people to there as well. So you don't even need to do anything. You literally just look at the website and that's all free for you. So, oh, and there's that resource we developed with Victoria from Neurodivergent Birth as well. So yeah, there's lots on there.
Lovely. Oh, do you know what? I'm so pleased. You've answered all my questions and beyond, Sally. I wish you good luck in the
Wave.
future. Thank you so much for everything that you do in supporting
Huge,
parents.
huge well done for Maternal Mental Health Awareness Week, and congratulations for year 10. It's
I know,
epic, and yeah, it's amazing. You've
I
done
know. I'm
such
so
amazing work.
pleased. I'm a bit tired, but it's the best
I
kind of
bet you
tiring.
are. I bet you are.
It's
I
our
hope you've
best.
got a spa day planned for the end of May. That's all I can
Well, I've
say.
got an appetizer.
That'll do.
I'll do. And my nail flew off earlier, so there we go. But on another call, it just went woo. So there we go.
Yeah.
It's floated through
Oh,
the air. But thank you. I'll let you go. But I'm
thanks,
so
Eve.
pleased and I'm so proud of you. And well done on everything. Okay.
Thank you, Eve.
Thank
Take
you,
care.
lovely. Bye bye.